All right, this is Understanding Students with Disabilities, presented by Heather Johnson and Terry Christensen. Characteristics of students with disabilities are different, even when they have the same type of disability. Students will have vastly different characteristics, even within the same category of disability. The more you learn about students with disability, the more each student will appear unique.
Knowledge of students' abilities will ultimately be more valuable than knowledge of their disabilities. It is more important to get to know the student, their unique strengths, learning styles, interests, goals, aspirations, feelings, and fears.
Person first, language of respect. Refer to the person with a disability, not a disabled person. Avoid outdated and degrading terms. Person who uses a wheelchair, not wheelchair person. Always talk directly to the person, not through a companion standing nearby.
All students have the same rights. All students have the same right to be of our society and participate in its activities. Try something new and risk failing. We must remember not to shelter our students, but give them opportunities to learn and grow.
Autism, a syndrome affecting language, measured intelligence, rate of development, and responses to people, events, and objects. May be unable to communicate or socialize in typical ways. May be preoccupied with objects or other items that appear unimportant. May display body rocking, head banging, unusual hand movements, uncommon posturing, or repeated speech. The focus is often developing alternative behaviors that are more appropriate.
Interacting with students with autism. Effective interaction often depends on developing two-way communication. Become familiar with what communication system the student uses. Many require a highly structured classroom environment, clear expectations, fast-paced instruction, and positive consequences for acceptable behavior. Activities should be as regular and predictable as possible.
Blindness or low vision. Considered legally blind if they see at 20 feet what others see at 200 feet, even with glasses. Require assistance in understanding their place in space. May use computers or books with large print. When interacting with the student, ask the student if you can assist them with transitioning. Keep the layout of the environment consistent. Become familiar with any assistive devices the student may have.
Understanding students who are deaf or hearing impaired. Deafness means a hearing loss or severe that a student cannot hear spoken language even with hearing aids. Hearing impairment means a hearing impairment which is not as severe as deafness. Many individuals with deafness or hearing impairment do not consider their condition a disability. When interacting, speak clearly, find out how the student communicates, ask the teacher how to interact with specific students.
Understanding students with emotional disturbance. Students with an emotional disturbance may display a wide range of behaviors that are different from those expected in classrooms, including aggression, violence, verbal threatening, destruction of property, inappropriately, or withdrawal. Students may seem unable to control or change their pattern of behavior. They may appear to have poor memory or short attention span, to be preoccupied or anxious.
Interacting with students who have an emotional disturbance. Be respectful, make expectations small, praise success in a genuine, sincere way.
Learning disabilities. Students learn more gradually and are limited or often delayed in their learning of academic, language, communication, and social skills, defined by an IQ score of 69 or below. Students may have problems making responsible decisions and may need support to successfully complete daily activities. This diagnosis is made during the developmental period.
Interacting with students with learning disabilities. Use clear, specific language. No cliche or abstract concepts. Make sure you have students' attention before giving instructions. Examples, say student's name or have eye contact. Model appropriate social behaviors. Students can learn by imitating correct behavior. Praise students when they are successful. The students may not realize their own success. Instructions may be broken down into small parts called task analysis.
Understanding students with orthopedic impairments. Orthopedic impairments include physical and neurological disabilities, such as cerebral palsy. Students with cerebral palsy experience physical and neurological problems due to the damage of the nervous system. Spina bifida. Students with spina bifida experience a birth defect of the spinal cord. Muscular dystrophy. Students with muscular dystrophy experience deterioration of muscles connected to the skeleton.
Interacting with students who have orthopedic impairments. Interaction depends on specific characteristics of individuals. Some students may require physical lifting or transferring.
Epilepsy. Temporary lapses of consciousness or seizures. Seizures may occur frequently or rarely. They vary in length and intensity from a few seconds during which students stare blankly to several minutes during which students display major convulsions. Many students take medication which partially or completely controls the seizures.
Students with attention deficit disorder, ADHD, have an extreme difficulty attending to tasks in a classroom and may appear impulsive and out of control. Attention may be drawn to sounds of a fan, a cough, a sneeze, or be distracted by walking in the hallway, a bright poster, or a missing floor tile. Many students may take medication. This is not a cure-all and should not be considered a substitute for good teaching.
Interacting with students with ADHD. Minimize the distractions. Keep the pace of instruction fairly rapid. Move faster if the student appears bored, slower if hyperactive. Describe expectations in positive terms. May need to make expectations small and achievable. Provide hands-on learning experiences. Mix easy and hard tasks. Always stick to the topic.
Understanding students with specific learning disabilities. Generally, students with learning disabilities have deficits affecting information processing, perception, memory, or attention. These deficits produce problems in reading, writing, spelling, math, listening, or speaking. Information processing. They may have problems with input and output of language. They may take much longer than other students to answer questions or solve problems. Perception, perhaps, is the most popular notion of learning disabilities is that students reverse letters and numbers.
Memory. Students gather information by hearing, auditory, or seeing visual. Attention. Some students with learning disabilities may appear distractible. They attend to many things but are unable to filter out things that are unimportant. Students with learning disabilities appear to have average to above average intelligence, although they have difficulties in academics. They do not learn at expected rates or even after repeated practice. Some students become frustrated, angry, or withdrawn.
Interacting with students with learning disabilities. Don't accept I don't know. Create a respectful, trusting relationship. Combine visual and auditory information. Divide a lesson into parts. Be patient.
Speech or language impairments. A speech impairment, articulation, abnormal production of sounds, stuttering, problems with speech fluency, voice problems, speaking too loudly, softly, or hoarsely. Language impairments. Receptive language impairments involve understanding spoken or written communication. Expressive language impairments involve speaking clearly. When working with students, be respectful, supportive, and reassuring. Students are often self-conscious and quick to give up.
Traumatic brain injury, or TBI. Severe head injury. Abilities that might be affected include speech, language, memory, motor function, intelligence, and behavioral adjustments. Understanding patients and well-timed encouragement are important. Interaction requires consistency, frequent positive reinforcement, and encouragement.
Assistive technology and its role in education of students with disabilities. Assistive technology refers to the use of devices that increase the ability of people to get along in society to improve the quality of life. Examples of assistive technology device include wheelchairs, computers with synthesized voices aiding communication, computer screen readers for those with visual impairments, magnifiers for reading, hearing aid, teletypewriters so that people who are deaf can read and type phone messages, a lever to produce a round doorknob for people with reduced muscle control, and so forth.